cholesterol? What it is and why it matters. When it comes to heart health, one term you hear often is cholesterol. For many, it's associated with heart disease, strokes, and clogged arteries. But what exactly is cholesterol? Why does it matter? And how can you manage it? Cholesterol is not inherently bad. In fact, it is essential for life. Every cell in your body contains cholesterol, and your body uses it to make hormones, vitamin D, and substances that help you digest food. The problem arises when cholesterol levels in the blood become imbalanced. This guide will explain everything you need to know: types of cholesterol, how it works in your body, risk factors, testing, and steps to maintain healthy cholesterol levels. What is cholesterol? Cholesterol is a fat-like, waxy substance produced naturally by your liver. It also comes from the food you eat, especially animal products like meat, dairy, and eggs. While cholesterol is vital for body functions, too much or the wrong type can be dangerous. Cholesterol is transported in the blood by proteins called lipoproteins, because fat cannot travel alone in the bloodstream. There are two primary types of lipoproteins you need to know. 1. LDL to the bad cholesterol. LDL stands for low-density lipoprotein. It carries cholesterol from the liver to other parts of the body, such as cells and tissues. While some LDL is necessary, too much causes problems. Excess LDL can build up in the walls of arteries, forming plaque. Plaque narrows the arteries, a condition called atherosclerosis, which can restrict blood flow. This increases the risk of heart attack, stroke, and peripheral artery disease. LDL targets: optimal, d100 mg/dl. Near optimal, 100 to 129 mg/dl. Borderline high, 130 to 159 mg/dl. High, 160 to 189 mg/dl. Very high, 190 mg/dl. High LDL is often influenced by genetics, poor diet, sedentary lifestyle, obesity, and certain medical conditions. 2. HDL to the good cholesterol. HDL stands for high-density lipoprotein. It carries cholesterol away from the arteries back to the liver for removal from the body. High HDL helps prevent plaque buildup. Higher HDL levels are protective against heart disease. HDL targets: low risk, 60 mg/dl. Low HDL, D40 mg/dl men or D50 mg/dl women associated with higher cardiovascular risk. 3. Triglycerides. Triglycerides are another type of fat in the blood distinct from LDL and HDL. They store unused calories and provide energy for your body. High triglycerides often occur alongside high LDL or low HDL. Elevated triglycerides increase the risk of heart disease and pancreatitis. Triglyceride levels: normal, D150 mg/l. Borderline high, 150 to 199 mg/dl. High, 200 to 499 mg/dl. Very high, 500 mg/dl. Why cholesterol matters. Cholesterol is essential for life. Your body uses it to build cell membranes, produce hormones such as estrogen, testosterone, and cortisol, make vitamin D-form bile acids that help digest fat,
which can contribute to plaque formation in the arteries and increase the risk of pancreatitis.
It's important to remember that cholesterol management is not about a single number. The balance between LDL, HDL, and triglycerides matters far more than isolated values. For example, a low HDL combined with high LDL is far more dangerous than having slightly elevated LDL alone. Maintaining this balance through healthy lifestyle choices, regular monitoring, and medical guidance is essential for long-term heart health. Lifestyle strategies to improve cholesterol. 1. Healthy diet. Increase soluble fiber, oats, beans, fruits, and vegetables. include healthy fats, olive oil, avocado, nuts, reduce saturated fats, fatty meats, full-fat dairy, avoid trans fats, fried foods, packaged snacks. 2. Regular exercise. Aim for 150 minutes of moderate aerobic activity per week. Resistance training improves HDL and overall metabolic health. 3. Weight management. Losing 5 to 10% of body weight can improve LDL, HDL, and triglycerides. Even modest weight loss reduces heart disease risk. 4. Quit smoking. Smoking lowers HDL. Quitting increases HDL and improves artery health within weeks. 5. Limit alcohol. Excessive drinking raises triglycerides. Moderate intake is key if you choose to drink. 6. Medications. Statins, bile acid sequestrants, or other drugs may be prescribed if lifestyle changes aren't enough. Always follow your doctor's guidance. Cholesterol and heart disease. Cholesterol is a major factor in cardiovascular disease. Plaque buildup in arteries narrows blood flow, which can cause angina, chest pain, heart attack, stroke, aneurysms. Managing cholesterol effectively reduces the long-term risk of heart disease. Studies show lowering LDL by 1 mol Ni 39 mg DL reduces heart disease risk by Ni 20-25%. Special considerations. Children and adolescents. High cholesterol can occur in kids, especially with a poor diet or obesity. Screening is recommended around age 9 to 11, especially if there's a family history. Pregnancy. Cholesterol naturally rises during pregnancy, usually monitored as part of overall metabolic health. Older adults. Slightly higher LDL may be acceptable if it reduces the risk of low blood sugar or medication side effects. Goals should be individualized. Modern advances in cholesterol management, technology, and medicine have improved how we monitor and manage cholesterol. At-home testing kits allow quick lipid panel checks. Continuous metabolic monitors track blood fat responses to diet. New medications. PCSK9 inhibitors dramatically lower LDL for high-risk patients. Cholesterol is not the enemy. It's a vital substance that your body needs. The danger lies in imbalance, too much LDL, too little HDL, or high triglycerides. Managing cholesterol through lifestyle changes, regular testing, and medications if necessary can prevent heart disease, stroke, and other complications. Even if you feel healthy today, cholesterol can silently affect your arteries. Understanding your numbers and taking steps to maintain balance is one of the most important things you can do for long-term health. Check your cholesterol today. Know your numbers. Take control of your heart health. Watch our full video to learn exactly how to lower LDL, raise HDL, and protect yourself from silent heart disease.